Hi, I am back. Let us continue. Raise your hand if you're able to hear me clearly. All right, that's good enough. So we were looking at the ventilation perfusion ratio. And what I had stated previously is that when when an individual breathes in and oxygen gets all the way down to the level of the alveoli. At the point that oxygen reaches the alveoli, the pulmonary capillaries must have deoxygenated blood coming from the right side of the heart so that the diffusion of oxygen and carbon dioxide can occur at that point. If the blood reaches the pulmonary capillaries and there is no oxygen available, then the blood will be recirculated to the left side of the heart without oxygenation. And that creates a ventilation perfusion mismatch. So it can lead to a lot of complications. All right, now effects of respiratory compromise on the body. The oxygen levels fall and the carbon dioxide levels will rise. When we have low oxygen, that is referred to as hypoxia. When we have excessive carbon dioxide, that's hypercarbia. And as carbon dioxide accumulates in the body, it will combine with water to form carbonic acid, which causes the pH to become more acidic. And the body will try to compensate for that acidosis by increasing the respiratory rate to break up the to break up the carbonic acid to carbon dioxide and get rid of it via exhalation. Now, shock or low perfusion occurs when organs and tissue do not receive enough oxygen. Impaired oxygen delivery causes cellular hypoxia. Hypoxia is low oxygen. It is categorized into several types depending on the cause. So you have various types of shock, which we will go into in more detail when we cover that specific chapter. Now, the effects of shock or low perfusion on the body will include the level of oxygen supplied to the tissues will drop. Cells will utilize more anaerobic metabolism, which leads to the buildup of lactic acid. The patient will develop severe metabolic acidosis. Baroreceptors, which respond to pressure changes, will initiate the release of epinephrine. Epinephrine affects the heart and the lungs. Norepinephrine will affect the blood vessel. And the goal would be to increase the heart rate. And interstitial fluid will start to move into the capillaries. And interstitial fluid is fluid between the cells within the body. Now, impairment of cellular metabolism. It results in the inability to properly use oxygen and glucose at the cellular level. Cells create energy through anaerobic. That shouldn't be. Hold on. Cells create energy through. Cells will create energy through anaerobic metabolism, and this leads to a metabolic form of acidosis. brain cells cannot use alternative fuel. So the brain needs oxygen, it needs glucose, and it needs specific nutrients. It doesn't have any backup supply for that, right? Cellular injury may become irreversible. So if we start to lose brain cells, they don't regenerate. Start to lose heart cells, they're not going to come back. And that would be the end of the chapter. Not going to go through the questions. Well, maybe I should. No. And again, maybe. All right, let's go through the question. Question number 1. Anybody familiar with the retroperitoneal space? The peritoneum is the membrane that houses the intestinal organs. So the retroperitoneal would be behind the peritoneum, which structures would be located in the retroperitoneal space. Anybody have a response to that question? I see a B. I see C. Okay. C would be correct. Spleen is spleen is left upper quadrant. It's not retroperitoneal. All right, the cartilaginous tip of the sternum is called the cartilaginous tip of the sternum. I'm seeing various answers. Interesting. That would be D, the xiphoid or xiphoid process. Number 3, a person with bilateral femur fractures has okay. All right, I'm seeing a lot of B's. B would be correct. The most prominent landmark on the anterior surface of the neck is the all right, I'm seeing a lot of C's. C as in cat. That would be correct. That would be correct. All right. Insulin is produced in the okay. Seeing a lot of B's. B would be correct. All right. No, dash connects muscles to bone. Right? Seeing a lot of C's. That would be appropriate, I believe. Right, number 7, the normal resting adult heart rate is okay. All right, seeing a lot of B's. B would be correct. The left atrium of the heart receives blood. Sorry, the left atrium receives dash blood from the all right. I'm seeing quite a few A's, so that would be acceptable. Number 9, the largest part of the brain. Seeing mostly A's, A would be correct. So A would be correct. All right, number 10. Which of the following statements about red blood cells is false? All right, seeing a lot of C's, so that would be appropriate. All right, that would be correct. All right, not bad. Not bad at all.